PDPM has been in place for several years now, but many nurses entering the MDS role still find the system confusing. The confusion often isn't about the rules themselves. It usually comes from misunderstanding how diagnoses, documentation, and clinical categories work together. Once those relationships become clear, PDPM becomes much easier to understand. One of the most important concepts in PDPM is clinical classification. The resident's primary diagnosis is used to determine the clinical category that drives the therapy components. Different diagnoses map to different clinical categories, which affects how the resident is classified under PT and OT. Understanding how diagnoses map to these categories is a key part of the MDS coordinator role. Hospital documentation often lists multiple diagnoses for a resident. However, the MDS coordinator must identify which diagnosis best represents the reason for the skilled stay. That diagnosis must then be mapped correctly to the appropriate PDPM clinical category. Misunderstanding how diagnoses map to categories is one of the most common challenges for new coordinators. Another important concept is that documentation drives the entire PDPM process. The resident's classification depends on information documented by multiple disciplines. Therapy documentation, nursing documentation, physician notes, and other clinical records all contribute to the information used in the assessment. Without clear documentation, it becomes difficult to support coding decisions. PDPM also includes multiple components that evaluate different aspects of the resident's care. These components include PT, OT, speech therapy, nursing, and non-therapy ancillary services, or NTAs. Each component evaluates different clinical information about the resident. Understanding how these components work together helps coordinators understand the resident's overall classification. Many new coordinators are learning several different concepts at the same time. They are learning the MDS assessment itself, the documentation workflow, and the structure of the PDPM system. When these pieces are unfamiliar, the system can feel complicated, but with experience, the connections between diagnoses, documentation, and classification become clearer. The key to understanding PDPM is recognizing how diagnoses, clinical categories, and documentation work together. Once those relationships are understood, the system becomes much easier to navigate. This understanding is an important part of the MDS coordinator role. If you're looking for tools and resources to aid you on your MDS journey, check out our shop at 5starmdsnavigator.gumroad.com or come see us on Etsy at 5star Navigator.